Welcome everybody. I'm Frans van Houten, the CEO of Philips, and I'm really pleased to be joined here by Dr. Laurie Glimcher, the CEO of Dana-Farber Cancer Institute in the Boston area, as well as Andy Jassy, CEO of Amazon Web Services. Both great people who share my passion for innovation and to drive and make a difference in healthcare. Now, I'd like to explain briefly why we have chosen the title of this session. We call it Democratizing World-Class Care Through Digital Health Ecosystems. We think that as we are combating the COVID-19 pandemic, this topic is hugely important. Because what we saw in the COVID period is that people were not getting the care they needed unless it was COVID related, and many elective procedures were postponed, but also cancer patients were not getting access to the doctors and the knowledge and the care that they needed. So that's a terrible situation, and we believe that digital health ecosystems actually can break that wide open. So that is fantastic, and the panel is going to help us unearth, let's say, the insides of the COVID-19 pandemic to them. We will then also be looking at, how can we improve healthcare delivery, leveraging technology, thereby empowering care providers to deliver their services, but also give patients access to care at the right time and place. We will also be dwelling on, what does it take to scale this? Because we are very much aware that while technologies can be great and concepts are fantastic, there are hurdles along the way to really make this happen in every part of the world, in every corner of the country. So I'm looking forward to a great conversation. Before we go into the interactive discussion, I also would like to share a little bit how I have experienced the COVID pandemic, and then I'll ask Laurie and Andy to do the same. Well, when we woke up in January, we saw China coming right at us with a lot of demand, and it triggered a huge learning curve for all of us. And we embraced what we call the triple duty of care, to take care of patients, the health and safety of our employees, and of course, business continuity. And we all realized that the purpose of Philips to improve people's lives has never been more relevant. And we had to step up on many areas. For example, critical care equipment, but also people struggling with the data interoperability. For example, as patients were transferred from one hospital to the next, the data interoperability wasn't there, and we had to solve that through informatics solutions. People were keen to understand the trends, and therefore AI could help understand how the disease was trending, but also how, for example, bed utilization was evolving. And then, of course, we saw a huge demand for our telehealth solutions. Screening, monitoring of patients at home, also give relief to general practitioners, using telediagnostics, remote supervision of patients, you can name it. There's one conclusion for me, and that is that COVID is a huge accelerator in the digital transformation of care. What is also very much clear is that people suffer when they don't have access to care. And how can we really build a resilient healthcare system where care is accessible to everybody? In other words, democratize care, where we can also ensure that elective procedures can continue. That is what we are going to talk about, and it's with great pleasure that we have Laurie Glimcher here in our panel. She's heading up Dana-Farber, focused on oncology. And Laurie, we are really keen to hear how you have dealt with the pandemic so far. How have you managed to keep giving care to the patients that are in great need? It must have been a tremendous challenge.
Thank you, Frans. It has been quite a time. It's not without its silver lining, because we've learned a lot during the pandemic. We certainly could not stop seeing patients, because even if there's a pandemic, that doesn't mean that cancer is going to wait. Cancer isn't going to wait. And we learned a lot during the pandemic, especially about the need for flexible and effective methods to help patients communicate with their doctors and nurses and share their information with their providers and care team. And one of the first things we did was to rapidly turn up telemedicine. We had maybe 5 to 10 telemedicine visits a week prior to the pandemic. We now have about 3,000 telemedicine visits a week. As the pandemic has slowed down somewhat, we've been able to see more patients in person and fewer on telemedicine. But, you know, our goal is always to surround our cancer patients with a team of people, a family, as it were, who are going to take care of them in every way possible. And we were concerned that we would have a hard time doing that virtually. But in fact, it turned out to be much more patient-friendly than we thought it would be. And for those who didn't need to be seen on site, you know, a telemedicine visit really saves them from traveling in, for waiting as they get their blood drawn or so on and so forth. They can still see a doctor virtually, and the doctor can see them. And another benefit for telemedicine is that during the time of the pandemic, we could not allow accompanying spouses to come into the Dana-Farber for fear that they would contract COVID-19, and nor could we allow other visitors. So if you do it on telemedicine, many cases, family members who couldn't accompany a patient to a physical visit were able to join the virtual appointment. And we felt that we could do this in a way that still provides the level of support and compassion that we provide to patients in person. And I think
Laurie, you also do a lot of research, right? And research is actually the lifeblood for all the knowledge that you have. And was the research affected in this period?
it was a bit. There were about 6 to 8 weeks when we shut down our research labs. We urged our researchers to continue their work at home. For the data sciences, for dry lab, that made no difference. They can work remotely perfectly happily. For our wet lab researchers, it of course was very frustrating, but I think we were the first institution in Boston to bring all of our researchers back. So it was somewhere between 6 and 8 weeks that we had them all back and had them physically distanced, et cetera, et cetera. We put all of those precautions in place. And the 6 to 8 weeks they had at home, they used to write new grants, to finish up their manuscripts, to have lab meetings remotely, and so forth. So I don't think we really lost much time, frankly. I think we've made it up.
Well, that's great, and we're going to come back because that knowledge that you have researched has a great way to enable cancer diagnostics and cancer care through your pathways. And stay tuned, we're going to go back to that topic. But for now, I'd like to switch to Andy Jassy of Amazon Web Services. Because Andy, in your experience, you must have seen also a lot happening in people embracing the cloud. I mean, you are the biggest cloud provider in the world, so tell us about that.
Yeah, well, it's like a lot of places. It's been crazy here the last 6 months, and we just haven't had the ability to shut down at all. Just because if you look on our retail side, people needed PPE and they needed food and they needed all the items they normally have. And on the AWS side, we really spent all of our time trying to figure out first how to keep our employees safe who had to be in physical facilities, but then also how to keep businesses and governments and organizations having the business continuity they needed going through this pandemic and being at home. And, in the short term, what we've seen is that every company in the world is doing everything they can to save money. And we've spent actually in the last 6 months, most of our time trying to help our customers cost optimize so that they can survive this, really difficult period and have a sustainable business over the long term. However, what we've seen is that, as happens in any kind of discontinuity like a pandemic, people step back and reevaluate what they're doing strategically and make different decisions about how they want to move forward. And the cloud has unquestionably pushed large enterprises toward using the pandemic and COVID have pushed enterprises unquestionably toward using the cloud. And they realize that if they don't have to run the infrastructure themselves on premises, where they have to pick up that extra cost, and they move a lot slower than they could in the cloud, they have a big advantage when they emerge from the pandemic in advancing their customer experience and changing their business. So we see the COVID crisis pushing acceleration of the cloud probably by 3 or 4 years. And it's kind of your move, Frans. And I think healthcare is the next to really follow in a big way.
Well, I'm sure that healthcare can learn from other industries, and so perhaps you have some meaningful examples or even examples in healthcare that you have seen over the last period.
Well, there are a lot of them. I mean, I'll just start even in the healthcare space. If you look at Moderna, that built their digital supply chain and manufacturing capability on top of the cloud, and they're able to, even in the most recent vaccine that they have created for COVID, they were able to do it on the cloud in 43 days versus the 20 months it typically takes. Or if you look at Cerner as an example, they've built machine learning models to run on top of the cloud where they're able to detect congestive heart failure, the onset of it, 15 months before you see any clinical manifestation of it. So you're just seeing a lot of companies that are now starting to use the cloud to change customer experiences and what's possible for patients and their customers.
Well, I recognize that, Andy, and I think it's a great segue to the second part of our discussion. We have seen COVID creating this unique momentum to accelerate innovation and especially adoption of innovation, but also very much driven by the need to connect patients to caregivers, to connect caregivers to caregivers and make sure that they can have access to clinical expertise and also continue to do their research in real time. So that goes back to the title of Democratizing Healthcare and giving people access. Between Dana-Farber and Philips, we have been working on a solution named the Philips Oncology Pathways, powered by Dana-Farber. It's basically capturing the knowledge base of Dana-Farber in clinical decision support to actually make it accessible to hospitals around the world. And we are very enthusiastic about the promise of what that can mean and how many more patients can be helped through that knowledge. So it brings me back to Laurie. Laurie, Dana-Farber is leading in cancer research. I'm so glad to hear that you're continuing that work despite the pandemic. But already before COVID-19 hit us, you had the wisdom to move to the cloud. And can you share how you have been using telemedicine to make sure that your expertise is being brought at the right time and place to other people to advance cancer care?
Yes, I'm delighted to talk about this. I think there's nobody listening that cancer hasn't touched in one way or another. And when you think about it, 2 out of every 5 people are going to develop at some time in their lifetime cancer. It's going to be the leading cause of death in both the 45 to 64-year-old age range and also in older individuals, and supplant cardiovascular death, induced death. So, it is an incredibly exciting time in cancer care and research. There's been so many new discoveries, some of them coming from Dana-Farber, leading to new treatments that can help more patients. And we need to make sure that the best cancer care is available to all patients. We see a lot of second and third opinions, and about 20% of patients that are sent to us, to Dana-Farber, we find that they've received either a misdiagnosis or they're on the wrong treatment schedule. And that's not fair. And Pathways has been an enormous help. We built this tool with the expertise of our Dana-Farber clinicians, together with Philips, to help oncologists everywhere around the world quickly identify the very best treatment for an individual patient, by providing guidance, by providing a clear map with key factors to use in making clinical decisions, because cancer's really an incredibly complex set of diseases. There are common cancers, there are rare cancers, and cancer medicine is changing rapidly. So this is forcing physicians around the world to interpret massive amounts of new information from publications and from clinical trials. And I think that Pathways has really helped physicians sort through these deep and complex sets of information by integrating radiology, pathology, genomics, and electronic health records data to support clinical decisions. So as we develop each pathway, the specific physician team, whether it is genitourinary cancers or whether it's breast cancer or another kind of cancer, they work together to evaluate the evidence and to identify clinical characteristics that should be taken into account when we're selecting a treatment. They go ahead and discuss the pros and cons of each, and then together the group decides, okay, what's the best treatment for any given cancer condition? So we then put defined treatment standards into practice and use the data from how clinicians treated their patients to understand, educate, and further refine the approach to cancer care. So this provides a guideline, a roadmap for physicians anywhere, local oncologists, primary care docs who are treating cancer patients, to use and navigate and hopefully, based on that evidence, reach the best possible treatment for their patient. And it's backed by the power of the entire cancer community. So it's democratization of cancer care.
Yeah, well, that's beautiful, but that means that you need to bring a lot of data together, turn it into knowledge, turn it into wisdom, make it available to others. Surely there were many challenges that need to be overcome. Can you talk to that?
Well, it was a huge amount of work on the part of our clinicians to gather together all these data and to then carefully outline guidelines for physicians who want to utilize this resource. And we learned from each pathway experience. And that actually deepened our collective cancer knowledge. And it also helps us improve how we support more oncologists by incorporating and evaluating the data from each experience. So this is not a standstill set of guidelines. We keep on adding new things to the set of guidelines as new clinical trials surface, as new therapies surface. So it is quite a substantial amount of work for our clinicians, but I think we've also had a good time doing this. I mean, it covers 95% of all cancer diagnoses.
But you also mentioned to me, Laurie, that as you bring knowledge into, let's say, clinical decision support tools and algorithms and AI, that you need to have a representative set of data from multiple ethnicities, multiple people around the world. Surely that must be one of the challenges where you discover that maybe the Boston area is not a representative data set of all the patients that need to feed the clinical decision support algorithm.
Yeah, and we are very open to working with other hospitals. In fact, we hope that providers from other hospitals and can review our pathway process and give us feedback in it that expands our collaboration and makes our decision making even stronger. So working with Philips in the Pathways program, it's really become much easier to share this expertise. Hospitals and providers can integrate this platform with any electronic medical record platform that they use, which makes it more available. But, there are challenges in reaching a group decision, especially as it relates to developing a particular pathway. But, academic debate is the way that we develop our content, and the rigor that's applied to reach a treatment consensus, I think, leads to a stronger product that is effective for the broader cancer community. I mean, I think the biggest barrier is the perception that this is cookbook medicine, but it's not. It's really highly advanced and rigorous scientific collaboration.
Yeah. Yeah, but of course then we need to get all the data from the patients so that we can compare those patients to your reference cases. And it brings me to then a question to also Andy. Andy, as you are listening to what Dana-Farber does, massive amount of data. How is technology going to help us in your view, and perhaps also again with knowledge from other industries?
Well, I don't think that we can do what we want to do in healthcare and fulfill the promise of what I think a lot of people imagine if we don't make it much easier for people to collect the data and organize the data and analyze the data. And I think if you're going to do large scale analytics or machine learning, you need some things that without the cloud, I think it's nearly impossible to do. I mean, data lives in all of these different enterprises and across industries in all these data silos. I mean, just think about first within an enterprise, how many different groups and different geographies and different organizations this data lives across. And then even healthcare, think about whether it's in, electronic medical records or lab systems or image repository, they live in all these different places. And you have to find a way to take all that data and largely put it together in a data lake. And you have to have the right access control and the right security around it. But you want that data in one place where the analytics services and machine learning services then can run on top of it. And you also need ways to normalize that data because the data is in all kinds of different formats. I mean, you heard Laurie talk about all the work the clinicians had to do to get that data in a state where you could actually use it across all the different resources. And it's so time intensive for companies now. And then you need the right analytics and machine learning tools then to do the work to get real predictive insights out of it. And in the cloud you have so many more analytics capabilities and machine learning capabilities than you'll find elsewhere. And you want to give your people the opportunity at every layer of the stack to do that analytics, whether you have expert machine learning practitioners who are comfortable building models themselves and training them and tuning them and getting results. But increasingly, if you really want machine learning to be expansive at large enterprises, including healthcare organizations, you've got to make it much easier for everyday developers and data scientists to be able to build, train, tune, and deploy machine learning models, which is, we built this service called SageMaker, which does that. We have thousands of companies, including many healthcare companies, that are standardizing on top of it because it changes their ability to do machine learning. And so I think those are all very important. And, again, loads of examples. I mean, if I look at kind of what Philips is doing with the Health Suite digital platform, where you're analyzing and storing 15 petabytes of patient data and 390 million imaging studies, adding a bunch all the time. When you layer machine learning on top of that data, it helps you identify at-risk patients and deliver diagnoses and develop evidence-based treatments. You look at companies like Novartis, they are using the cloud and AWS to add real-time enterprise-wide views of the throughput in every factory. And by having that data all in one place and they're running machine learning and analytics on top of it, it totally changes what they're able to deliver and what they're able to see in the quality of their data. And it allows their scientists to run all kinds of different models much more quickly so they can develop complex solutions that before weren't really possible.
Well, that's a great bridge then to our third part, because we heard from Dana-Farber how, the knowledge can really help diagnose the patients in the correct way and select the right treatment. And we heard from Andy how this can potentially be scaled, and other industries are doing it, and it can accelerate. So we have together created the pathway tool. But is the world ready to adopt this at scale? That's my third question. Laurie, what do you feel are the next steps that need to be taken to scale, let's say, what you have done at Dana-Farber and democratize it and bring it to a lot of other institutions and get, let's say, also regional clinics to benefit from the knowledge and thereby probably advancing the democratization of care?
We've been in the midst of two pandemics. One is COVID-19, but the other one is racial injustice. And I think we all believe that we have to create better access to the latest cancer treatments for all of our patients. it's not enough to just be not racist. We have to all be actively anti-racist. And I think we're really, truly, this is a defining moment for social justice and healthcare here in America. And we certainly are committed at Dana-Farber to doing our part to address systemic injustices. And COVID-19 is an example of that. Which populations have been most affected by COVID-19? Where are most of the deaths occurring? They're in minority populations. So we're working hard at Dana-Farber to diversify our leadership. We don't have nearly enough diverse representation at the executive level. That's a top priority. And we're working very hard to reduce disparities in cancer care. And
are other practitioners in oncology in other parts of the country willing to take your advice, to use your expertise and tool?
Yes.
Are they ready for that?
I think, I think there's a nationwide recognition of how much we have left to do to make cancer care, high quality cancer care, available to everybody. I mean, if you look at adult patients, African Americans have the highest mortality rate of any racial or ethnic group for all cancers combined in the US, and Black men in particular have the highest rates of cancer. So, a lot of studies have been carried out, and they clearly link socioeconomic factors to the incidence of cancer. So at Dana-Farber, we've reinforced our commitment to providing equitable care through programs that are focused on social determinants of health, on cancer prevention, on cancer screening, cancer care equity. We're trying to create better access to clinical trials for patients of color, including through a recent partnership we forged with Boston Medical Center and Mass General. We've also started now working closely with the Boston VA. So we all have to break down these barriers. We have to create better access.
We all have to, yeah. Well, and of course we have to make sure that, let's say, your pathways get accessed by other institutions, and that we get you access to the data so that you can continue your research. So Andy, data is still locked up in silos, right? How do we unlock all the treasure troves of data also around other parts of the population, so that we can research it and we can turn it into clinical decision support for the world?
Well, I think there are a couple things. Some of it, a lot. When you look at the biggest difference between the companies and the industries that are really making progress and getting into this next generation of technology and using the cloud and getting benefits from it versus those that don't, it's often not technical. It's really, frankly, leadership. And it's very much within the leader's control. And so the very first thing is that you have to decide as an industry that you're going to make the data interoperable. And there are some industries that are maybe a little bit further ahead on that. In financial services, if you look at some of the data that organizations like FINRA make available around the market that change what all the different member institutions can do, or in the energy space with the subsurface data that they're sharing now and going to be able to do analytics on. I think that healthcare has made a good start with things like the FHIR format, which make it a little bit easier to standardize. But there's just a lot of data that wants to be shared across a lot of different silos, where the organizations have to decide together that they're going to do so. And it's the only way really to have the right 360-degree view of the customer. And and then I think it's up to people like us and others to, once there are decisions to make that data accessible to one another, to make it much easier to normalize that data and be in a position to analyze it. Because I think today, in the cases where organizations are sharing data, there's so much work and so much heavy lifting in making that data the same format so you can actually run analytics and machine learning on it, that it just takes too much time. So I think those are some of the things we need to make happen.
Okay, and should we be afraid of privacy issues, Andy, or can it all be done in a secure way?
I think anybody that has data that matters, security and privacy is job number one. We often call it job zero, because you can't do anything unless you make sure that is secure. But the reality is that when most people look at what you can do in the cloud versus what they do on premises, and they look carefully at it, they realize that they have a much stronger security posture in the cloud than they do on premises. And so you absolutely can do it securely. And there are so many capabilities around access control and how to make sure that only the right people can have access to the right functions or the right data and from certain locations at different times. There are so many ways that you can make sure that only the right people have access. And then if you're worried about it, encrypt that data in multiple ways.
That's right.
That you can absolutely do securely. But it comes back to leadership. You have to decide as a leadership team and as an industry that you want to make it happen and have conviction about it, and then work together to find the right solution. Because it's, there are a lot of considerations, and a lot of companies and organizations have different things they have to think about it. You just have to decide you want to do it together.
That's right. Well, thank you. Thank you, Laurie, and thank you, Andy, for fantastic contribution. What we have discussed that during COVID time, we saw that certain groups of patients were suffering and not getting access to the right care. And often it is the people that are less privileged that suffer the most. And cancer is going to continue to grow. We need to find new models to make access to care the best possible care possible. What we have been discussing here, that through the pathway knowledge and clinical decision support system that Dana-Farber and Philips have developed, we can actually democratize healthcare. And we have heard from Andy from AWS that the cloud is a huge accelerator and that we can connect patients to doctors, to knowledge, and to the care that they need. So that is fantastic. And then I think I want to underline what Andy said, that it is about leadership, because this can be achieved right now if we want it. Right? We can scale it right now when we want it. And this is therefore also a call to everybody here in the audience, because we are leaders, you are leaders, that together we need to say we want data to become interoperable. We want, let's say, clinical decision support to help tear down the disparity in access to care and knowledge. That can all be achieved if we work together. I look forward to building the future of care together, and I'd like to hand it back to our health organizers now. Thank you.